So we're evaluating a thigh mass, upper thigh mass. As you can see here, this part over here is the skin, and as we go down, all of this area right here is the mass. You can see some areas of hypoechoic and some areas of hyperechoic, but around the mass. So we'll see what all that is about. What I'm going to do is take some cells from this mass and see what they're about. Perfect. So what we're doing today is we're going to do an aspiration of this mass. You can see it's palpable at about 8 by 6 centimeters. And so what I'm going to do is put a needle inside here and get some of the cells off. And I've already explained with the patient and consenting the patient, and he's okay with me doing the video as well. But we're going to go in here with this is called the fine needle aspiration, is what we're doing. And that's basically. So again, we're going to put a needle in here and look at this mass under the scope. I've already explained to the patient, he's consented. So what I'm going to do is using a tiny needle, even smaller than the one used for drawing blood. Here's the needle in view. So I'm just you're going to feel a quick prick and then it's over. That's it. Good job. You did real good. So we're going to get some of that fluid, those cells out of there. And we got some. Once you see blood in the hub, you basically have enough cells and you can come back out, and then I'm going to have the patient hold this for me. Okay. Going to hold that for me. Perfect. All right, let me see what we got in here. And we got a very good sample, and we're going to see what we got. Keep pressure on it. Hold pressure on it real tight for me. So I have here some slides that I'm going to prepare. So I'm going to squirt some of the cells on that slide there, if you can see it, right here. Do a little small drip. Let me see, hold back so we can see. So I'm going to put some cells on here. And that's good right there. That's good enough. I'm going to put the needle down, and we're going to smear this. I want you to hold that for me if you don't mind. And I want to show how I make my smear. So I usually start by doing a smear like so, and smear it this way. You see how mucoid it is. And the other thing I'm going to do is I'm going to take another smear from the needle here. I'm just going to drop some more cells on there, and then we're gonna smear that by pulling the slides together, and then smear it like so. So I'm gonna look at this one first, and then I'll let that other one air dry. Okay, that's the smear here. You can see I got a good smear. I'm gonna discontinue the video now. So we're viewing the thigh mass now from one of my telepathology setup, and I'm just going to scan around. This is a smear that I took from my FNA, and I just want to kind of peruse it around for you to see the overall component of the cells. And it's going to go in and out of focus because I'm scanning at very low power, but you can see that I got a very nice aspirate and cellular material, and this is from upper thigh aspiration, so you shouldn't even see this many cells that you see here, and we'll go down and look at it at a closer perspective, but I just want to kind of scan it around so that you can see what I'm seeing on low power, that this is a cellular aspirate primarily comprised of mononuclear cells, and some of those cells, those single cells, are quite sizable, and we'll take a closer look at them up close as I continue to peruse around for you to see the cellular aspirate material. But it was a nice aspirate that we were able to collect from FNA, and it's going to go in and out of focus. Like I said, I mean, this is really out of focus right now. Let me see if I can get it back into a viewable situation. And what I'm going to do is go in and zero in on a more closer view. But right now, I'm just scanning around just to kind of show you the overall picture of what I'm looking at. And I'll go down to show the individual cells. Hopefully, it'll be a lot better than what we're seeing here. But you can see it's a nice cellular aspirate that we should be able to come up with what's going on. Okay, I'm going to go to the next video. Here's a closer view as I continue to peruse around. I still don't want it on too much of a high power view, but you can see these fairly large sizable cells here. Those are mononuclear cells, and you have to worry about some sort of high grade lymphoma that may be in highly unusual for a soft tissue mass, but very possible that this could be like an extranodal lymphoid sort of process. But I just want to kind of continue to peruse around. I know it's going to continue to go in and out of focus, but my goal is to show you the cellular aspect first. And again, I'm videotaping from, this is not directly from my iPhone, but from the computer. So it's not as high resolute as I want it to be, but I'm going to still kind of go down closer as I continue to scan around for you to see that I do have some adequate material to evaluate. So let me just go on and go see if I can get a closer view on this and see what we get on this. Okay, that's a good, okay, this is perfect. So you can really see the cells there, those single gigantic cells. Even on this on this high power view and this one image, this wouldn't be considered benign. So just to see those cells as big as they are, those are tumor cells until proven otherwise. Now the question becomes, are they epithelial tumor cells or lymphoid tumor cells? My suspicion is that it's going to be possibly a lymphoid neoplasm, but like an extranodal lymphoma. But again, my recommendation to the patient was that we get this mass completely excised so that we can study it a little better from histology standpoint. See that I hate to see that little epithelioid nest right there, and so we have to also rule out some sort of poorly differentiated epithelial neoplasm as well. So get the whole lesion out, and then you can study it a lot better than what we have here, which just is this is a good area right here. That's a thick section, so it's hard to say what's going on there. But I just wanted to kind of keep on perusing around that. I think we've come so far in our diagnostic armamentarium, and I think no patient should have to wait for long periods of time to get a diagnosis when simply you can aspirate the tumor cells from an FNA and send that sample for further evaluation. But some of these cells are pretty sizable, and I'm trying to find, maybe we'll see some neutrophils in between and go from there. Thank you.